So this was a multi-center clinical trial, prospective observational study, looking at patients with CLL, specifically focusing on the efficacy of the SARS-CoV-2 vaccines in these patients. The original trials that led to the authorization of these vaccines didn't typically include patients with leukemia. And obviously patients with CLL are very vulnerable to infections, particularly COVID. So the cancer centers sort of put together their efforts in terms of evaluating the vaccine efficacy. And when I say efficacy, specifically I'm talking about how all the vaccines worked in terms of inducing an antibody response to the vaccines. And what we found was that the vaccines don't work as well for patients with CLL. For healthy patients, the response rates were 95%. In patients with CLL who've never seen treatment, it was more in the lines of 75 plus. Even for those not on treatment, it was in the 70s. And for people receiving treatment for CLL, specifically BTK inhibitors, venetoclax, the response rates to the vaccines were lower. And this ASH, we've shared that data earlier, and this ASH, what we're doing is sharing the information regarding the infections patients develop. What we found is that after patients received their initial vaccinations, the infection rate for COVID was still very low. People were, very good at masking and social distancing, and with the vaccines, patients didn't get COVID that often. But after the boosters, we found that people were developing higher rates of infection, and I think some of that speaks to the fact that we had sort of let down our strict precautions regarding masking and social distancing. I think it also reflects, new emerging variants of COVID that are escaping the vaccines. And so what we do based on this is mainly educate our patients just to continue to be careful about getting it because, it's unfortunate to get COVID at this point in time.